All right, everybody, welcome to the chapter on gynecologic emergencies. This is another brief lecture in comparison to some of the other ones, although there are some significant things in this lecture. So if everybody can kind of keep their head above water, and we're going to try to get through this and get to the finer points of what's going on. So unfortunately, women, girls and women alike, will sometimes have gynecologic problems requiring some urgent care. And this can be one of several issues, which is going to be excessive bleeding, soft tissue injuries, some kind of STD, or a vaginal discharge that's abnormal in nature. If we're looking at the anatomy of the female reproductive system, you can see that the general area of the genitalia is actually fairly complex on a female. There are many different parts of what's going on there, and we can look at the overall location being the vulva, and without me reading off the entire list, you can see that there are many different parts that make up the female genitalia. The vagina being the outermost cavity of the reproductive system, this is what we call the vaginal canal, and this is the lower part of the birth canal where the baby is exiting the mother. This begins at the cervix and ends as an external opening. It also will house the urethra as well, and the uterus, being the womb, is the body part or the organ where a fetus will grow. It's made up of the fundus, the uterine cavity, the endometrium, and the myometrium. Directly above the uterus are the fallopian tubes, and the fallopian tubes carry the egg from the ovary to the uterus for implantation. Can also allow sperm to exit from the uterus towards the ovary, guiding and kind of creating that pathway for the two sex reproductive cells to combine and create the fetus. The ovaries function to produce ova, which is the mature eggs that are leaving the ovary, and they also produce some hormones inside the body. Those hormones would be estrogen and progesterone. These are secondary sexual characteristics, and they prepare the uterus for pregnancy and assist in the development of mammary glands. Now, women do also have testosterone inside their bloodstream that is produced by the body as well. And it's just in a significantly smaller portion as compared to men. So in the normal physiology of the reproductive cycle, hormone levels rise each month to stimulate the development of an egg. This causes the endometrium of the uterus to thicken in preparation for implantation. The ovum is released around the 14th day from the beginning of the menstrual cycle. And then if there is no fertilized egg implantation into the endometrium, the menstrual cycle will then begin again. And this is the shedding of the uterine lining, which causes the temporary bleeding from the vaginal canal that women experience in a normal 28 to 30 day cycle. So the term for this is menarche, when there's the initial onset of menstruation. This occurs basically during puberty and can actually happen as young as 10 years of age. Menopause being the cessation of menstruation and ovarian function. This usually occurs somewhere between 45 and 55, and in some cases can go a little bit longer, and in some cases can actually end a little earlier than 45. This is again one of those things where when we have female patients, we always want to make sure that we ask them clinical questions about their ability to procreate. And this is, are they still having a normal menstruation? Have they begun it, or have they gone into menopause? Both of these are the reasons that we want to make sure that we're having that clinical discussion with our patients about whether or not they have actually begun their menstrual cycle or have they ended it. And if they're somewhere in between, we want to know if they have a normal menstruation cycle and whether or not they may or may not believe that they're pregnant, because this can change the way that you're going to treat some of your patients based on the risks involved with the fetus and particular drugs that you may or may not give your patient. Now, there are a couple of disorders that can lead to a gynecologic emergency, and this could be acute or chronic infection, the rupture of a cyst, or the rupture of an ectopic pregnancy. And so when we're talking about acute or chronic infection, this could be a massive UTI that has become more of a renal problem. They could have some kind of infection from an STD in the vaginal canal or the uterus. The rupture of a cyst is pretty typically something where the polyovarian cystic syndrome, where the ovaries are creating cysts to kind of release this egg, and some of them can be so significantly large that this can cause some kind of bleeding. Or in the case of a rupture of an ectopic pregnancy, this is where we have an embryo that implants into the fallopian tube and then has now resultantly grew to a size where it has exceeded the capabilities of the fallopian tube, and that particular piece of tissue then ruptures. We've talked about this in a previous lecture. One of the things in abdominal issues with females is PID, or pelvic inflammatory disease, and this can be caused by an acute or a chronic infection of the pelvic cavity. The chief symptoms are pelvic pain and fever, and some of this complications that come about from this is sepsis, abscesses, peritonitis, and can result in infertility. None of the PID would be worth talking about if we didn't briefly cover some of the STDs, or the sexually transmitted diseases, or STIs, sexually transmitted infections. One of those being bacterial vaginosis, which is a pretty common condition to affect women. This is where normal bacteria is displaced by an overgrowth of another bacteria from the vaginal canal, and it can actually end up inside the uterus. Some of the symptoms are itching, burning, and pain, and this can be treated with a routine medication. Another one of the sexually transmitted diseases is cancroid. It's very contagious, it's curable, and it may cause painful sores and swollen, painful lymph glands. The symptoms may be actually asymptomatic, and these patients may not know that they're suffering from it for quite some time. Chlamydia is another one of the mild or absent of symptoms sexually transmitted diseases. Some women will experience lower abdominal pain, low back pain, nausea, fever, or pain during intercourse, or bleeding, like a spotty type of bleeding between their menstrual periods. If untreated, this can spread to the rectum and progress to pelvic inflammatory disease. All right, some more of the sexually transmitted diseases. This is cytomegalovirus, or CMV for short. It's a pretty common infection with no known cure. It also can cause high fever, chills, headache, malaise, extreme fatigue, and an enlarged spleen. And that's because of the chronic infection. The people at risk for an active infection are those with immune disorders, chemotherapy because of how chemotherapy knocks out the immune system, and pregnant women. Another one of the sexually transmitted diseases is genital herpes, and this is an infection of the genitals, the buttocks, and the anal area. Pretty much anything that there could be consistent moisture associated with it. The primary cause is by the herpes simplex virus types 1 and types 2. It used to be generally thought that type 1 was a oral cold sore, and that type 2 was a genital cold sore. It is apparent that these two are communicable regardless of general area. The telltale signs are small red bumps that can develop into painful sores, which happens in an outbreak, so to speak. This is very easy to kind of look at if you have friends or family, or yourself, if you suffer from an oral cold sore. The lesions are very similar in nature regardless. And this is pretty difficult to attack or treat in regards to the virus because it literally lives inside the nerve cells. It will go dormant when there's a healthy immune response to it. And it will kind of stay hidden inside that particular nerve root, and the sores will go back to the same area on a regular basis. because of the nerve that it's actually infected in. The particular outbreak comes as about from immunosuppression, which could be high levels of stress or sickness, where the immune system is unable to kind of keep that virus in check. Moving towards gonorrhea, moving forward to gonorrhea, this is a bacterial infection that grows and multiplies rapidly in a warm, moist area, such as the reproductive tract or perhaps the urethra. The bacteria causes a painful urination and occult blood associated with intercourse. If it's left untreated, it can enter the bloodstream and spread to other parts of the body, including the brain. Gonorrhea and I believe the next subject of syphilis were both considered to be lethal conditions just about 150 years ago. Okay, so this is the section on syphilis called the Great Imitator. And the reason it's called the Great Imitator is because its early symptoms will create lesions, either oral or on the genitalia, that can be misdiagnosed as something else. And so because of that, it gained the name the Great Imitator. This is transmission through direct contact, so that's some kind of sexual contact, be that oral or traditional. The primary stage is one or more sores, secondary stage being the mucous membrane lesions and a rash, and then late stages are going to be internal damage. And this also can travel all the way into the brain, causing massive brain damage if left untreated for quite some time. Moving forward into genital warts, this is most often caused by a common STD of HPV, which back I think in 2012 there was a vaccination given to young females of a certain age that had thought to not have come into contact with the HPV virus. And many more of these particular vaccinations are becoming more and more readily available for both males and females, but it's traditionally given to females. HPV is a causative agent in cervical, vulvar, and anal cancers. And in pregnant women, the warts may impede some kind of urination or obstruct the actual birth canal. Moving forward into trichomoniasis, this is generally including symptoms of vaginal discharge with a very strong odor that's not directly attributed to a UTI, irritation and itching, and then discomfort during intercourse. There can be dysuria, which is the abnormal urination, and then lower abdominal pain. If untreated, this can lead to premature birth in pregnant females, low birth weight, and because of the infection, there's an increased susceptibility to HIV infection. Vaginal yeast infections, the normal acidic environment of the vaginal canal keeps yeast from growing. If the vaginal canal becomes less acidic, the yeast population can actually overgrow and become infectious. And then this can be affected by oral contraceptives or antibiotics that are changing the chemical composition of the mucous membranes. Some of the symptoms for this include itching, burning, soreness, and vulvar swelling. And unfortunately, this is one of the common conditions that many women will have to deal with at least once in their lifetime. So unfortunately, in the cases of females or women, most sexually transmitted diseases are almost guaranteed to be transmitted from male to female because of the penetration and the deposition of bodily fluids into females. And this is why using condoms is paramount to your sexually reproductive health. And the inverse is also true with males. While there is a very high likelihood of transmission to men, it's not as often as men to women.